Dinosaur Adventure Land in Lenox, Alabama, November the 18th, 2023. 3 weeks ago, I went up to do a wedding for Patrick Yurish, and they're still happily married after 3 weeks. That's wonderful. I tied a good knot, he said. Patrick is taking over Bill Sardi's information and spreading it out around the world about the knowledge of health, how to be healthy. What does the Bible say? So Patrick's going to tell about his program and what he's doing and take it away about how can you be healthy. You have any health problems? Call Patrick. You have any evolution questions, call me. I can handle that. But call Patrick with any health problems. Patrick, tell us about yourself and how you got started in all this.
Yes, sir. Hello. My name is Patrick J. Yurish, integrative health practitioner. I was watching Kent Hovind for a very long time now, and through me watching him, I found out about an investigative health journalist by the name of Bill Sardi, and he's been my inspiration for continuing this health information and getting his advice out. He had a couple sites that a lot of people may be familiar with, knowledgeofhealth.com, resveratrolnews.com. Very amazing sites, just a wealth of information. And unfortunately, we lost Bill Sardi a couple of years back, and I'm just trying to continue his work, continue his advice, continue his information, and help people out with their health. A lot of these pharmaceuticals, unfortunately, are problematic. People are coming to me with problems with them, side effects with them, and I'm just trying to give natural possible alternatives that may prove beneficial. Just as a disclaimer, to start here, I'm not a medical licensed doctor. The advice I give doesn't diagnose, treat, prevent, mitigate, or cure disease. While nutraceuticals, vitamins, minerals, amino acids may do so, they are not allowed to make that claim. That's for medical doctors.
And I'm not a medical doctor either, but I'm smart enough to know most of the drugs are treating the symptom, not the cause. I mean, you're putting headphones on because your engine's knocking. How about check the oil instead? So, Patrick, tell us how to check the oil. What's your body need when you have certain problems or diseases? What do you need?
Absolutely. So one huge vitamin, like I explained last week, is vitamin C. You need vitamin C. We all need vitamin C. Our body uses up vitamin C at a rapid rate. The half-life of all consumed vitamin C is about 30 minutes within your body. Most mammals, like I said, produce vitamin C internally. They make their own. We do not. We have a mutation. We can no longer secrete vitamin C naturally. We need dietary vitamin C or supplemental vitamin C. And for anyone out there who wants to begin supplementation, 40 milligrams per kilogram or 2.2 pounds of body weight is usually the minimum amount for optimal health. If you want to do the math on that, about 145 pound individual would need about 2,500 milligrams of vitamin C per day. So about a teaspoon. You need vitamin C. You need vitamin D, another crucial vitamin. It's important for your immune system. It's important for your bone. It's very, very, very important. If you don't have enough vitamin D, you're going to develop or you're going to increase your chances to develop autoimmune conditions. This is where your immune system or your body starts to attack itself. So rates of Hashimoto's, thyroid disease, rates of lupus, rates of MS will just skyrocket in the absence of vitamin D. We need vitamin D. So tonight's seminar is going to be more so about prenatal health and what vitamins, minerals, amino acids you need to have a healthy baby and continue that baby's nutrition.
But I don't intend to have any babies.
Well, for any listeners out there,
I mean, I've never had a baby. My wife has had some, but I never. Anyway, go ahead, brother. Tell us about prenatal vitamins.
I know you say all that pain they talk about in childbearing, you didn't feel anything.
I didn't feel nothing. No.
You didn't feel a thing. All right, so are my slides up here? All righty. So, prenatal health and wellness by myself, Patrick J. Yurish, integrative health practitioner. So I'll be taking through people listening what they need for their baby's health, what they need for their own health during pregnancy, and how they could carry on that health afterwards. So here we go. So how do I next slide here? Okay. So there's a lot of things that are very, very, very important for prenatal health, for your baby's health when you have a baby on board. Now, one thing, specifically mineral, that's very important that we don't hear talked about enough or a lot of times even at all is iodine. Iodine is tremendously important for your baby's health, for your babies, specifically IQ. We'll get to that later, and for your own health. And we don't hear about this that often. So, benefits of iodine and iodine supplementation. It's found in seafood. It's found in eggs. I would prefer you get farm raised pastured eggs. It's found in very good high quality seaweed, sea kelp, and you can get a supplement. You can supplemental iodine. Now, there are many, many, many benefits of iodine. And these benefits of iodine supplementation, iodine consumption, go past just preventing a goiter. When we hear iodine, we think, okay, we need that to prevent goiters, which is an enlargement of our thyroid gland, but it really doesn't go past that. Now, that's just not the case. There's more and more evidence, very, very frequently coming out that a greater iodine consumption is correlated with less cancer rates, and also directly correlated with less fibrocystic breast disease. So we tend to think that our thyroids are the only part of our body that sucks up iodine or accumulates iodine, and this simply is just not the case. When we take iodine, there's a lot of extra thyroidal benefits that come from iodine supplementation. Now, something that's not commonly known is our salivary glands accumulate iodine. So when you take iodine, when you supplement with iodine, you actually will start to experience any extra thyroidal benefits, which are antiseptic mucosal defense in your mouth because your salivary glands start to accumulate iodine, and also your stomach mucosa. You'll experience antiseptic mucosal defense in your stomach. So you'll have less bacteria, less candida, less infections in your gums, in your mouth, just from simply supplementing with iodine because your salivary gland also accumulates iodine. So, how much iodine do we really need? There's a lot of confusion around iodine supplementation. A lot of people don't actually know what amounts they need. And when you look at the RDA, the recommended daily allowance, or the DV, the daily values, a lot of them will say you need no more than around 150 micrograms of iodine per day. They often will often say that you need iodine in just a microgram amounts. That's it. There's 1,000 micrograms in a milligram, and there's 1,000 milligrams in 1 gram. And they'll say if you ever go over a milligram, you're going to experience iodine toxicity. It's going to become toxic. Well, let's just check that out. So, a study conducted in the 1960s showed Japanese iodine consumption to be 13.8 milligrams per day. That's 13,800 micrograms. Way, 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 way above what the RDA, the daily value, is. They say 100 micrograms, 150 micrograms, any more than a milligram, toxic. Well, the Japanese, for a very long time, have been consuming over 10 milligrams per day, and they experience very, very low rates of breast cancer, fibrocystic breast disease, and we'll get to this a little later. Their babies, their children, especially even first generation Japanese children in America, have very high IQs. Comparatively speaking, a lot higher than other surrounding countries. So, today, 1 in 7 women will develop breast cancer in their lifetime. 30 years ago, the rate of breast cancer was 1 in 20 women, and this is said to be correlated with iodine consumption. In the past, 30, 40, 50 years ago, we were able to get iodine from many, many different sources. Even you went down to the local grocery store and you were able to get iodine from bread. Iodine was used as a bread conditioning agent. One slice of bread contained over or around 140, 150 micrograms of iodine. One slice and you were sufficient. So people had way more iodine consumption in America 30, 40, 50 years ago, way more than today. And they experienced less fibrocystic breast disease. They experienced less breast cancer. And their IQs, believe it or not, were a lot higher. Today, we're experiencing a very great drop in IQ points, unfortunately. So, should we ever be afraid of too much iodine? You can get iodine in microgram amounts. You can go on Amazon and get Lugol's iodine in milligram amounts. 1 drop equals 2.5 milligrams. You can take an iodine pill. Now, should we be afraid of too much iodine? Well, Albert Georgi, he was around from 1893 to 1986. He was the physician, the man who discovered vitamin C. He was a medical student. He was a medical professional. And he wrote, when I was a medical student, iodine in the form of potassium iodide, Ki, the common form of iodine, was the universal medicine. Nobody knew what it did, but it did something, and it did something good. We students used to sum up the situation in this little rhyme. If you don't know where, what, and why, prescribe you then K and I. K, obviously, due to the periodic table of elements, is potassium, and I is iodine. They would prescribe iodine. This kind of fizzled out in the 40s and the 50s, and now doctors no longer prescribe it. But it was the quote-unquote universal medicine in the early 1900s. The standard dose of potassium iodide in the early 1900s was, get ready, 1 gram. That's 1,000 milligrams or 1 million micrograms. That is a lot more than the 140, 150 micrograms they recommend today. Bill Sardi would often quote a man by the name of Donald Miller, who's a famous cardiac surgeon. We'll talk about him later. And he would talk about how iodine in greater amounts than these small microgram amounts were quite beneficial, and they provided extra thyroidal benefits. And we see that even 100 years ago, how it was commonly used. 1 gram iodine contains 770 milligrams of iodine, or 7,700 micrograms. I'm sorry, 770,000 micrograms. So for many years, doctors would treat various maladies with potassium iodide, and doses starting at 1.5 grams or 1,500 milligrams or 1.5 million micrograms to 3 grams, and would increase to a dose more than 10 grams per day on and off, 10 grams equaling 10 million micrograms. Very common. Doctors did it all the time in the early 1900s. Today, they do not do it, but it's a very, very, very beneficial mineral, and we need it to live. Next slide. So, iodine, continued. Your baby's IQ depends on this, and so do you. Benefits of iodine during pregnancy, specifically. So, iodine, if there's no other time you take iodine, it should be during pregnancy. It is tremendously important for the baby on board. Why is it so important? So there were studies carried out in 2005 in China, and these studies indicated that there was an increase of 12 to 17.25 IQ points in children born more than 3.5 years after iodine supplementation. Their IQs increased dramatically from iodine supplementation. Another study conducted by the Cognitive Effects of Micronutrient Deficiency, Evidence from Salt Iodization in the United States in 2013 said, quote unquote, we find that for the 1/4 of the population most deficient in iodine, this intervention raised IQ by approximately 1 standard deviation. Simple iodization increase in salt consumption increased IQ by 15 points. Iodine is directly correlated with increased IQ. Even the World Health Organization, which has its flaws, of course, stated in 2013 that iodine deficiency may decrease IQ by 15 IQ points, and this is obviously during pregnancy. Your baby needs IQ, and so do you. So George Fletchus, a very, very prominent iodine researcher, states, quote unquote, he's very famous, babies born to mothers on the high iodine protocol, this is just 12.5 milligrams. I would recommend personally go on Amazon, get a bottle of Lugol's iodine, and just take 3 drops per day. It's 2.5 milligrams per drop, so you'd have about 7.5 milligrams. It's totally safe. It's totally healthy. So babies born to mothers on the high iodine protocol, 12.5 milligrams of iodine per day, are genius level babies. He states mothers who took high doses of iodine have IQs, the babies have IQs 20 to 30 points higher than their parents. This is astounding. This research doesn't get out much, but it's very much seen in the studies and the research conducted that mothers who supplement with iodine have smarter babies, and quite smarter based off of the research. Next slide. So, slide number 4. What, besides iodine, should your diet consist when you're pregnant? What should you eat? There's a lot of confusion around it. There's a lot of confusion what increases or what gives your odds of the most healthy baby, what gives the odds of the most baby with less chance of any birth defects. And we see an increase of birth defects, and we see an increase of just maladies in children more and more and more today. And why is this? Why is it way more than just 50 years ago? Well, just to bring in some scripture verses for us, Isaiah 7:15, butter and honey shall he eat. This is a prophecy about our Lord Jesus Christ. Butter and honey shall he eat, that he may know to refuse the evil and choose the good. So, I believe scripture gives us, God in his infinite wisdom, a lot of good advice that even extend to our diets. I believe God has included within the Holy Bible ways for us to eat that would produce the most health. And we see, like a verse I talked about last week was, drink no longer water, but use a little wine for thy stomach's sake, and then often infirmities. Well, wine, grape juice, peanuts, contain a very, very, very beneficial, Bill Sawyer talked about it all the time, molecule called resveratrol. Now, resveratrol has a ton of different benefits, but one thing that it does very well is it inhibits pathogens from sticking to our stomach lining, much like cranberry will inhibit pathogens from sticking to our urinary tract walls. Well, what are the odds that God said 2,000 years ago, drink no longer water, but use a little wine for thy stomach's sake? Resveratrol, found in wine, prevents pathogens from sticking to your stomach lining. You don't need a lot, 200 milligrams per day, and it's profoundly beneficial. Well, if we keep scouring through the Bible, we see other, I believe, verses that might indicate healthy foods. And one, Isaiah 7:15, butter and honey shall he eat. So, what are benefits of this? Well, butter, as Donald Miller, who Bill Sardi has quoted, Bill Sardi respected, a prominent cardiac surgeon, states butter is nature's perfect fat. We see butter often demonized quite often. We see a whole campaign against butter and in substitution for margarine and stuff along them lines, but it's actually healthy. You probably can't believe it, but it is. Butter contains many healthy saturated fats, some of which possess antifungal, antimicrobial, and anti-tumor properties. And butter also contains cholesterol. So, cholesterol is something that there's a lot of talk about, and there's a lot of people that say cholesterol is bad for you. Cholesterol will clog your arteries. Well, many medical doctors have a very hard push against demonizing cholesterol. And is that the truth? Is that the case? Well, I'm here to say that cholesterol is needed for life. Without cholesterol, you cannot live. You will die without cholesterol. Your body makes cholesterol. 80% of all cholesterol in your body, 80% of all cholesterol in your body is made from your body. Only 20% comes from the diet. You need cholesterol to live. Cholesterol is needed to make hormones like testosterone and estrogen. Cholesterol is needed to make bile. Bile is a detergent, a substance that's made in your liver, stored in your gallbladder, and it digests or helps break down fats and fat-soluble vitamins. And cholesterol is needed to make this. Cholesterol, there's a little tiny cholesterol layer in your skin, specifically called 7-dehydrocholesterol. And this cholesterol layer is what's converted to vitamin D when you're in the sun. UVB light, ultraviolet B light from the sun's rays, hits your skin and converts a form of cholesterol to vitamin D. You need cholesterol. Um, People have seen that the lower cholesterol levels people have, the higher rates of cancer they have. Not because cholesterol is in and of itself anti-cancer, but vitamin E actually hitches rides on cholesterol particles, and that's how it gets distributed through to different organs and places in your body that really needs it. So if you don't have enough cholesterol, you're not getting enough vitamin E to places where you need it, and you're going to develop cancer. So you need cholesterol. They actually find that people that have low cholesterol or lower cholesterol levels have a lot greater chances of depression and lower moods, because a decent percentage of your brain is cholesterol. So you need it. That's why, unfortunately, statin cholesterol reducing drugs are often dubbed in health communities as suicide pills, because you're just knocking down your cholesterol levels, and you're gonna get lower moods, and you're gonna get depression with low cholesterol. You need cholesterol. So the problem is not cholesterol. The problem is the hardening or oxidizing of cholesterol, which could be remedied with vitamin E and vitamin C. I talked about vitamin C last week. If you go back and watch that seminar, you can see all the ways you can use vitamin C, utilize this vitamin to help your body out. And if you want to begin vitamin E supplementation, you just need 400 IU to 800 IU per day, and that will prevent the oxidizing of cholesterol in your arteries. But cholesterol is good. Just to explain maybe a little more about this, doctors will say HDL is your good cholesterol, LDL is your bad cholesterol. Keep them in check. Well, both of them are not good, or both of them are not bad. Both of them are good, and neither of them are actually cholesterol. HDL stands for high density lipoprotein. It holds cholesterol. LDL stands for low density lipoprotein. It holds cholesterol. It's not cholesterol. HDL takes it from your body back to your liver. LDL takes it from your liver to your body. Neither of them are bad. Both are good. The only thing is, when it oxidizes, it could be in your arteries. And that's when you need simply vitamin C and vitamin E. There are two things that are very beneficial for this. Other things help as well, but these two vitamins are amazing for keeping your cholesterol flowing. So, butter also contains good amounts of fat-soluble vitamins, vitamins A, vitamin D, and vitamin K2. Fat-soluble vitamins are very important for many biological processes. Vitamin A, vitamin D, vitamin K2, tremendously important vitamins, tremendously important for pregnancy, tremendously important for your children growing up, and they're found in butter. Make sure it's grass-fed organic butter, but it's found in butter. Now, vitamin A is amazing for the children's eyes during pregnancy. You could have eye development issues if you do not have enough vitamin A in your body. You could have birth defects like cleft palate if you do not have enough vitamin A in your body. Vitamin D and vitamin K2 are also very beneficial. Believe like a lot of people know, vitamin D helps with calcium absorption, but vitamin D, the way it does this is it helps intestinal calcium absorption. But once vitamin D is in your bloodstream, or excuse me, calcium is in your bloodstream, it really can't do much until you have vitamin K2 as well. And vitamin K2 will just activate a couple proteins that help sweep calcium from your blood vessels and put it in your bones and teeth. And butter, surprisingly, has A, D, and K2. It's tremendous for us. And God said in Scripture, butter and honey shall he eat, that he may know to refuse the evil and choose the good. Amazing. Proverbs 16:24 now. We see that Scripture says, pleasant words are as an honeycomb, sweet to the soul and health to the bones. Pleasant words are as a honeycomb, sweet to the soul and health to the bones. So pleasant words are being identified here as like a honeycomb, in that they're sweet to the soul and health to the bones. So that tells me that honeycombs are health to the bones. Is this true? Does any science validate this? Well, honey contains important polyphenols. For anyone wondering what a polyphenol is, phenols are molecules that are in plants that provide antimicrobial defense, and poly just means 4 or more, or many. So many phenols. This is polyphenols, and they're good for us. So honey contains important polyphenols that may be beneficial for our memory and mood. The polyphenol content in honey also may lessen oxidative stress. So I discussed what oxidative stress was in my last talk. It's just pretty much you breathe oxygen. In this process, cells produce oxygen-derived free radicals. They're just little tiny oxygen molecules, and they're missing an electron to go around your body to steal electrons, and in doing so, destroy your cells in tissues. And honey can help with this. So PubMed, a very prestigious health site or site that conducts studies, states honey has promising skeletal beneficial effects in preventing osteoporosis. Pleasant words are as a honeycomb, sweet to the soul and health to the bones. Polyphenols contained in honey may have bone protecting biological actions. That studies indicate this. You would think the scripture was inspired. Pleasant words are as a honeycomb, sweet to the soul and health to the bones. So they recommend not giving honey to infants and children under 1 year of age, but after 1 year of age, I would give honey. It's good for them. It's good for the bones. It's good for their. It's good for their memory. It's good for their mood. Butter and honey, very, very, very wonderful foods that we could eat. Next slide. So, furthering on the diet when pregnant, and also we'll talk about morning sickness. So, the diet when pregnant, foods that you should eat are predominantly should contain iron, copper, and calcium. High amounts of iron, copper, and calcium. So just to talk about real quick, a theory that Bill Stardy stated and first made well known was called the over mineralization theory. And this was Bill Sardi's theory of why humans age, or the main factor in the aging process. So just to expound on a little bit on what this theory involves is during the childhood growth years, or before the age of physical maturation is reached, humans need all the iron, all the copper, all the calcium they could possibly get for their blood cells. They need all the iron they can get for creating new red blood cells, millions per second in their bone marrow. They need all the calcium they can get for building new bone, and they need all the copper they can get for connective tissue. Childhood is pretty much defined as a constant state of lack of these minerals. They're just using them up. It's very hard to become overloaded in these minerals. Now, if you look at a cell from a 1-year-old and a cell from an 18-year-old, they look about the same under a microscope. There are no signs of biological aging. They look very similar. Now, they have birthdays, of course, but they're not biologically aging. Now, when you start looking at cells of a 20-year-old, of a 21-year-old, we start to see aging occur. We start to see something inside the cells called lipofuscin. Now, what is lipofuscin? It's cellular debris, and it starts to accumulate inside the cells after physical maturation is reached. And the reason for this is because we have organelles within our cells called lysosomes, and they produce enzymes that help sweep all the cellular debris out of our cells. Now, what happens to these lysosomes after physical maturation is reached? They start to rust. They start to calcify. We start to accumulate iron, copper, and calcium. Our need for these minerals starts to decline, and we see aging start to occur. Now, once we reach 60 years old, 70 years old, the rate of aging starts to decline because ferritin, the iron storage molecule, does not increase later in life. The barrel is full. But aging, a main driving factor of aging is the accumulation or over mineralization of iron, copper, and calcium. Bill Sardi first made this very well known, and this could be seen. One example in nature is the naked mole rat. Rats live on average about 6 years. The naked mole rat, specifically the female naked mole rat, lives over 30 years. And the reason for this is it never stops having babies. It has about 100 pups annually, and it's constantly donating iron, copper, and calcium to its offspring, and it's preventing or heading off over mineralization. So, iron, copper, and calcium, driving factor of aging. However, when you are pregnant, you need iron, copper, and calcium as much as you can get. Iron for the baby's red blood cells, copper for the baby's connective tissue, calcium for you're building a whole new skeleton inside of you. You need iron, copper, and calcium. I wouldn't recommend pills for these. I'd recommend you get it from your food sources. And of course, don't forget saturated fat and cholesterol. Like I talked about before, cholesterol is beneficial. Saturated fat, butter, ghee, lard, tallow, or it's what Americans have used for centuries with no problems. And the problems of heart disease started to come with the increase of all these hydrogenated vegetable oils like soybean oil. That's actually the negative stuff. Butter is healthy for us. So eat your saturated fat, eat eggs, eat cholesterol. It's healthy for you. Believe it or not, Bill Sardi also made known that before all the cholesterol phobia in America, before all the anti-saturated fat presumed within America, there were very, very little, if any, fertility clinics, if any. After the saturated fat and cholesterol phobia started to abound, fertility clinics started to pop up everywhere. If you don't, very high carbohydrate, very low fat diet drops your fertility rates drops fertility dramatically. Cholesterol is needed for fertility. It makes hormones, it makes testosterone, it makes estrogen. It's needed for fertility. So foods high in iron when you're pregnant, I would recommend eating a lot more spinach, a lot more leafy greens. It contains iron that's absorbed on an as needed basis, and red meat. Red meat, like steak or eat liver, it has a ton of highly absorbable iron in it. And this is needed for your baby on board. Foods high in copper, which is needed for connective tissue, is needed for collagen, it's needed for the baby's skin, is almonds have a lot of copper in it. Cashews have a lot of copper in it. Sesame seeds have a lot of copper. Foods high in calcium, dairy, of course, and sesame seeds have a lot of calcium. Don't take calcium pills. I wouldn't take copper pills, and I would not usually suggest iron pills unless someone's dealing with anemia, because these pills could compete with zinc directly for absorption. I would just get it from food sources. It's in a lot of food. So additional beneficial foods, eggs, they have a lot of them fat-soluble vitamins, A, D, K, and they have cholesterol. We need cholesterol, especially if you have a child on board. And you need dark leafy greens when you're pregnant. Dark leafy greens have high amounts of a specific vitamin called vitamin K1 or phyloquinone, and this vitamin is a cofactor for blood coagulation. You need this vitamin for your blood to coagulate properly, for your blood to not just for you to just not bleed out. You need vitamin K1. Well, dark leafy greens have a lot of vitamin K1. So I recommend people on the third trimester of their pregnancy start blending up a little bit of spinach or a little bit of kale and drink a kale shake or drink a spinach shake. And what this is going to do is head off any need, in my opinion, and I would say even if you didn't do this, don't get this injection. But there's a vitamin K injection that's often wanted or desired to give to our children when they're born. And it's just to head off any bleeding that may take place. And this could be easily remedied or easily the need negated if you just take some spinach shakes. Just take some dark leafy green shakes. It has K1 naturally in it. It will help the baby not bleed. Don't get the injection of, in my opinion, this is not medical advice, of vitamin K. What this will do is over thicken the baby's blood way too much, and the stem cells from the umbilical cord will not be able to travel easy at all through the baby and make the reparative works necessary. And there's other negative harmful substances as well. So take leafy greens, take eggs, and eat butter and fermented foods. And I'll get to later why fermented foods are very crucial. So, morning sickness as well, we could talk about. Morning sickness plagues a lot of women, and it's grueling. It's unbearable a lot of times. They might need an IV drip for morning sickness. And Bill Sardi made known that morning sickness, not all the time, but usually is an overt vitamin B1 deficiency, thiamine deficiency. Your baby is using thiamine, vitamin B1. You can find it in a store at a very, very fast rate. Why? Because this vitamin controls your autonomic nervous system, your autonomous nervous system. This vitamin controls your heart rate, it controls your breathing, it controls your digestion, it controls your immune system, it controls autonomous functionalities. Now, vitamin B1 is sucked up by your baby, and you start to get nausea and arrhythmias and morning sickness and vomiting. If you would just supplement with 50 milligrams to 100 milligrams of thiamine, you could head off your morning sickness. Your baby is just sucking it up, and you don't really have much left. Supplement with it, and you can head off the chances of you developing this very, very, very bad condition. Next slide. So, folate or folic acid. This is a very, very common vitamin that everyone probably heard of, vitamin B9. All the doctors will talk about it when someone's becoming pregnant. It's in all our prenatals, and it's good for us, the right one. So vitamin B9 is needed to make DNA repairs, and precancerous cells will form in its absence. It's used to make DNA repairs throughout our bodies, and if we don't have enough vitamin B9, precancerous, pre-malignant cells will start to form. Now, vitamin B9 is generally known as the main vitamin that prevents birth defects. Out of all the other vitamins we could talk about, all the other minerals we could discuss, vitamin B9 is the one that's known to prevent birth defects. And this is why doctors prescribe it, and this is why they talk about it. However, our doctor is pointing us all in the wrong direction. So, doctors, when you become pregnant, will often recommend folic acid. Vitamin B9 is folic acid, and they'll give you 5,000 micrograms. Now, according to Bill Sardi, according to a lot of research done, according to a lot of studies conducted, this is way too much. 5,000 micrograms is an astounding amount. It's way, way, way too much vitamin B9. And the problem is it's in the not activated form. They will always give it to you, at least always that I've seen, as folic acid. Vitamin B9 as folic acid in 5,000 micrograms. Way too much vitamin B9. And the problem is a lot of people on this planet have a genetic mutation, and it's called MTHFR mutation, methyl tetrahydrofolate reductase mutation. It's a gene. They have a mutation on this gene, and due to this mutation, they cannot convert folic acid, at least not well, folic acid to the active form folate, methylfolate. So when doctors prescribe a huge amount, 5,000 micrograms, of the not activated form folic acid, what happens in a lot of people is this travels through their bloodstream not activated. And them prescribing this, in doing so, have increased the prevalency of autism and birth defects. So in trying to avoid birth defects by prescribing this, they ended up creating more autism and birth defects. So don't take folic acid. Don't take 5,000 micrograms. If anyone is pregnant or planning to be pregnant, take methylfolate. You can find it in a whole food supplement. Methylfolate, 200 micrograms to 400 micrograms. Or you could just avoid that and take dark leafy green vegetables. They're generally very high in vitamin B9 as the active form folate. Spinach, kale, just blend it up, drink it as a kale shake. It's amazing for birth defects. And it's very high in vitamin B9 in the active form folate. And a lot of people have this mutation, and just supplementing with that or supplementing with the active form could help you prevent mutations that are due, or birth defects that are due to your MTHFR mutation. Next slide. So this is a very kind of heavy topic, controversial topic that a lot of health professionals and naturalistic doctors have spoken out against, and it's around fluoride, the mineral fluoride. Fluoride is quite ubiquitous in water supplies. Fluoride has been added to baby's water a lot of times. They'll sell little tiny water bottles for infants, and it's fluoridated water. Fluoridated water is in toothpaste in pretty high amounts, sodium fluoride. And the reason for doing this is they say it increases teeth density. Now, a lot of demographics, areas are fluoridated water. Now, is it really advantageous to take fluoride? Well, fluoride consumption is correlated with lower IQ scores. You could find this information in a lot of different areas. Harvard, I believe, conducted a study that showed demographics with the highest amounts of fluoridation ended up with quite lower IQ scores, directly correlated. I would not give your babies fluoridated water. Don't give your babies fluoridated toothpaste. It doesn't increase bone density enough, or the trade-off is not appropriate. Take vitamin K2, give them butter, give them dark leafy green vegetables as they get older. These saturated fats, this is what's going to help their teeth. Now, believe it or not, vitamin D and magnesium are needed for appropriate development of enamel. So get them even in the sun. Yes, it'll actually help your teeth. I believe most dental caries or cavities come about during the winter months or in northern latitudes where sun exposure is not as prominent. Vitamin D and magnesium are helpful for proper enamel formation. Give your children butter, get them in the sun, give them some vegetables that contain magnesium. This will help their teeth. Fluoride is not the thing you want to give to help their teeth. Fluoride increases tissue permeability, which makes it such a potent neurotoxin. So fluoride, specifically we're talking about sodium fluoride for anyone curious, greatly increases permeability in your body through hard to reach places. It can readily get into your brain. It can get into your bone. It very readily increases permeability through these places. And this is why it's a very potent neurotoxin. It can get right into your brain. And when this happens, it's very clearly seen to promote docility in people and passivity. It makes you very passive. It makes you very calm. It makes you very docile. And it makes you your energy's gone, honestly, and it lowers your IQ score. So don't brush your teeth. In my opinion, with sodium fluoride containing toothpaste, you could use a whole bunch of natural. There's a gamut of natural toothpastes you could buy. You can mix baking soda and coconut oil, and that's a phenomenal toothpaste as well. I would just ward against sodium fluoridated toothpaste. It's not good for you, and it's not good for the baby on board. Unfortunately, it will lower their IQ scores. At least this is what the study conducted demonstrates. Next slide. So, foods to avoid when you're pregnant. There are various things you shouldn't really eat when you have a baby on board or when expecting. Things that could be deleterious to your baby's health and your own health, for a matter of fact. And these things include refined sugars, very processed, sugary foods. It's not good for you. It's going to lower your immune system. It's just going to cause excessive weight gain. Caffeine, specifically by this, I would not be drinking coffee when pregnant. Believe it or not, coffee blocks vitamin B1 from absorbing. So vitamin B1, like we discussed, is needed many times to negate morning sickness. It helps with morning sickness. A lot of times morning sickness is caused from an overt vitamin B1 deficiency. So if you're drinking coffee when you're pregnant, you're just blocking more vitamin B1. It's not healthy. And different preservatives are not good. Specifically, you want to avoid anything that says sulfite on the back. Sulfites are preservatives that they put in a lot of different things, but what these do is they actually will slow down or suppress a specific cell in your body called T cells. They suppress T cell function. Now, T cells are what we talked about last week. They're needed for your memory immunity. They are what remembers how to fight specific infections. If you don't have appropriate T cell function, or if you don't have enough T cells, which is a zinc deficiency, your body's not going to remember how to fight specific infections. And the last thing you want is to be sick when you're pregnant. So avoid the preservatives, avoid the refined sugars, avoid the coffee, and eat that foods that I was recommending on the previous slides. So nettle tea, if anyone's a tea drinker out there, and especially herbal teas, and they like their herbal teas, there's nothing wrong with herbal teas, but nettle tea and fenugreek tea may stimulate early contractions. They're actually used in the past to stimulate contractions in labor. However, don't drink them too early. It could stimulate early contractions, and fenugreek is used to induce labor. So antibiotics may be problematic during pregnancy. These prescription antibiotic drugs, of course, that we know that they do cause problems, especially if you're on them a lot. However, there's studies that indicate that these antibiotics, as well as C-sections, actually may spawn a greater risk for weight gain and obesity. And I think it's clear why this is, and I theorize it's because antibiotics kill your healthy bacteria. They wipe it out. You have more healthy bacteria cells in your body than you have human cells in your body. Healthy bacteria in your body are tremendous for helping you digest your food and helping you utilize your food more readily, and helping you, and they produce vitamins for you, especially B-class nutrients, which also help you utilize food as energy. So if you take antibiotics when pregnant, you are going to wipe out your healthy bacteria, and you're going to wipe out the amount of healthy bacteria your baby is going to get. And now it may increase weight gain because you don't have all this healthy bacteria that's helping you utilize food, and you don't have all the healthy bacteria producing vitamins, vitamin B class nutrients especially, that help you utilize food for energy. And we see the same with C-sections. C-sections, actually, the babies born by C-section will often miss out on a healthy boost of beneficial bacteria, and we see a greater risk, or we see greater chances of weight gain with children that were born by C-section. Now, nursed babies also have a lesser chance of developing weight. Why is this? Well, nurse babies, for one, they're not getting all the soy that's in these formulas. These formulas are loaded with soy. Don't give soy to your infants. It's very, very estrogenic. It's going to increase weight gain. But also, nurse babies have higher leptin levels. So what is leptin? If anyone has never heard of leptin, leptin is the satiation hormone in your body. It tells you, I am full. It tells you, I have ate enough. Now, what the American government health food companies have done to us is they stuck a bunch of high fructose corn syrup in our foods, and this induces leptin resistance. We do not know when we're full anymore. We eat and eat and eat and eat and eat. Americans just keep eating, and it's due to leptin resistance. Now, resveratrol actually will increase leptin sensitivity once again, so you could correct this. Resveratrol is amazing for that. However, nurse babies have higher leptin levels. They know when they're full. They know when they ate enough. And babies that were formula fed have lower leptin levels, and this, of course, increases the chances of weight gain and obesity. The American health food corporations are creating an obese, unhealthy society very, very readily or easily. Now, main thing, I don't know if I really could say this word on YouTube, but the injections that are often given to children when they're growing up is probably the number one thing you should avoid. It's a lot of health professionals say to never take these injections. Bill Sardi was very much against these injections. And the main thing is they contain something called adjuvants. Now, what are adjuvants? Adjuvants are horrific chemicals that are thrown in these vials that you're injecting into your children that are used to spark your immune system. This is mercury found in thimerosal. This is formaldehyde. This is aluminum. This is these harmful heavy metals and harmful toxins that are put in these injections that are trying to provoke an immune response. But no amount of these adjuvants is ever safe. They're carcinogenic. They may cause cancer. These heavy metals may go to your brain and get lodged in your brain or in your bone. They may cause autism related symptomology, symptoms related to autistic behaviors. They're just not healthy. And the reality is you could provide sufficient immunity to your children to fight against various maladies, infections, and ailments with simple vitamin supplementation, mineral supplementation. Namely, get your children zinc. Get a zinc drop. They don't need much. If they're maybe above the age of 6, I would recommend maybe 10 milligrams per day, or 5 to 10 milligrams per day. If they're below the age of 6, maybe 3 milligrams per day of zinc. It's a drop you can get, and it's going to help them make T cells. It's going to help them make memory immunity. You do not need these injections destroying their immune system. You need zinc. We have a whole population created that is now zinc deficient. And the reason for this is something called Roundup, and specifically glyphosate, and more specifically, the arsenic within the glyphosate. Roundup, glyphosate, it's an herbicide. It's sprayed in all our fields, a lot of them. It contains arsenic. Arsenic's quite ubiquitous now in our food. It's everywhere. And arsenic depletes the fields, the plants of zinc, and it depletes your bodies of zinc. Everyone right now is living pretty much zinc deficient. Most people are zinc deficient. So especially, you should take zinc, but your baby on the scene should take zinc, and it's better than vaccination in that it's not destroying their immune system with these harmful adjuvants they put within the vials. Next slide. So general nutraceuticals, which are non-patentable natural substances that I would also recommend to head off any maladies, ailments that may come during pregnancy and help you have the healthiest pregnancy. One, magnesium. It's a mineral. It's very, very, very important during pregnancy. Not as much as for the baby, but as for you. And the reason for this is there's a condition that sometimes comes with pregnancy called preeclampsia. And this is a very dangerous condition where your organs will literally start to become toxic and your blood pressure will skyrocket. It will increase dramatically. Now, magnesium, as stated by Bill Sardi, could very much prove quite beneficial to prevent this. It could be really good to prevent preeclampsia. 400 milligrams of elemental magnesium per day, that's all you need during pregnancy. And it's phenomenal to help with the possibility of preeclampsia. It's really good. Vitamin D, 5,000 IU per day. It's amazing for your immune system. It's amazing for helping with your bone. If you if you don't get enough sun, or if your vitamin D levels are too low, you can go to 10,000 IU per day. For anyone out there that has had a blood test to find out their vitamin D levels, a lot of women will sometimes have blood tests. What you want to see on your blood test is above 40, and maybe even above 60 if you're really healthy. And if you have any underlying conditions, you want above 80 and below 100. If you have autoimmune conditions, if you have cancer, you want to see your vitamin D levels above 80, below 100. Very good. Fish oil, 1,200 milligrams per day when you're pregnant. Why? It has something called DHA. It's an amazing omega-3 fatty acid. It is probably the most important thing after iodine for your children's brain development. Wonderful. And of course, like I said, zinc as well. Zinc is just a tremendous mineral. It's needed for T cells, and it's needed to reduce chances of autism-like symptomology. They find that parents or mothers who are very zinc deficient will have children that have autistic-like symptomology and behaviors. So zinc is actually very beneficial to head this off. These supplements are very good during pregnancy, and saturated fat, cholesterol are amazing during pregnancy. And I'll say avoid the drugs, avoid the injections, go the natural route. Bill Starr recommended many times and helped many people doing this. Thank you so much.
Well, thank you, brother. Very interesting. Patrick, I've got your phone number on the screen. If people want to call you, you're newlywed here, so if you don't answer, just try back, call back later.
That's
okay.
it. Keep calling.
What's your email? Email.
Yeah, so my email, if anyone has any questions, is Yurish, Yurish, .ihp@gmail.com. I'm a board certified integrative health practitioner, and I'm just trying to further Bill Sardi's work here.
All right. You're not giving medical advice, but you're saying this is what you would do if you want to stay healthy. And people have a right to make their own choice, I would think, with medical decisions, shouldn't you?
At this point, we're allowed to. I'm not sure how much longer, but at this point, we're still allowed freedom of choice with our medical interventions. So,
yeah, one guy said the doctor was going to give his baby a shot of some kind. He said, "Doc, you weigh probably 20 times more than my baby. Would you take 20 of these shots right now yourself?" Why not?
Wouldn't do it.
Anyway, thank you so much, Pat. See you next Saturday. Come visit when you get caught up there, and come visit Dinosaur Adventure Land.
Absolutely.
Thank you, folks. We'll see you tomorrow. Bye.
Thank you so much.